Hello, scientific writers. In this video, we're going to take another look at some careers in scientific writing. And today we're going to look at some data that was collected by the American Medical Writers Association. So this is going to be data on medical writing as a career. This data has been collected from medical writers in two categories: those that are employees of a company of some sort and those that are freelance medical writers. So let's get into the results of their survey. So this data is from the 2019 compensation survey. The salaries we're going to look at in this survey are probably higher now. We're going to start out looking first at full-time employed medical communicators. Let's start with looking at education level. The largest category in education level has a PhD or an advanced degree. Other degrees that medical writers commonly hold would be a doctor of pharmacy or a medical doctor, an MD. 32% have a master's degree and 21% have stopped at a bachelor's degree. In terms of years of experience, only about 7% of the respondents had less than 2 years of experience, 31% 2 to 5, 21% had 6 to 10 years, and 42% have more than 10 years of experience. So this is a career that you can do for a long time. 55% work remotely on any regular basis, and of that number, 48% work only remotely. Now again, this was in 2019. So now in 2021 and 2022, after we've gone through a couple years of a lot of people working from home, I'm pretty sure this number is going to be substantially higher. And if you like to work remotely or work from home, chances are that you can find a medical writer position that will allow you to do that. The employers are typically pharmaceutical companies, clinical or contract research organizations or CROs, medical communications companies, biotech companies, medical device companies, healthcare organization or providers, and also medical schools or universities. How much are medical writers going to make in terms of salary? If we break it down by type of work, this is the median gross salary for those that are primarily writers. It's about $107,000, and those that are primarily editors are making about $80,500. And when we break down the areas of writing, we can see that regulatory writing is the highest paid, followed by marketing and advertising, followed by scientific publications, and with medical research and grants on the bottom of the ladder. So if getting the maximum salary is something you care about, then you should aim your sights at regulatory type medical writing. These employees receive benefits as you would expect for most full-time employees. So some of the benefits include health insurance, retirement, life and disability insurance, professional development, pre-tax spending programs, and 60% are eligible for an annual bonus. Annual bonuses are a nice thing that you get in companies that you typically don't get in the university. So that's something to keep in mind too when you're deciding on who you want to work for if you want to be an employee. Now let's take a look at the survey results for freelancers. For highest level of education, 38% have a PhD or other advanced degree, 37% have a master's, and 23% have a bachelor's degree. So similar proportions as we saw for the full-time employees. In terms of experience, 16% have 5 or less years, 12% have 6 to 10 years, and 72% have more than 10 years of experience. So again, freelancing as a medical writer is something that can be a long and complete career. Now, freelancers are business owners. They own their own business and they have clients that pay them to do the medical writing. So they have to run their business. As an employee, you don't have to worry about running a business, and you don't have to worry about going out and finding clients, and you don't have to worry about paying yourself benefits out of your income. The company's going to do all of that. So as a freelancer, you're going to have a lot of extra responsibilities and expenses. The most common recurring expenses for freelancers in this survey were professional membership dues and subscriptions, paying for a tax accountant, paying their health insurance, their office, utilities, equipment, and supplies, and continuing their education and professional development. Now, what kind of clients hire freelance medical writers? In descending order of top sources of income, the respondents indicated pharmaceutical companies, medical communications companies, medical education companies, biotech, medical marketing or advertising or public relations, medical device companies, and healthcare organizations or providers. So we don't see any medical schools or universities on this list. How about the income? So the median gross income for full-time freelance communicators for writing is substantially higher than what we saw for the employees. For employees, we saw that the median salaries were $107,000, and for freelancers, the median income is $151,000. So on the surface, that sounds like a lot more money. But keep in mind that the freelancers are going to have to pay all of their own benefits from that money, and they're going to have to pay business expenses out of that money. So in the end, it might not be that much more than the employees are making. Now for editing, we see that the freelance income is actually lower than the full-time employees that were doing editing. We can also break down freelance medical writers' income by specialty. So those that are doing continuing education are bringing in the least amount of income, followed by scientific publications, sales training, marketing and advertising, and again, regulatory writing is at the top of the ladder in terms of the amount of income. All right, I hope this short video gave you some additional information about careers in scientific writing and medical writing. Thanks for watching and happy writing.